Goeienaand, good evening, fellow South Africans and citizens of the world. And I'm going to put a few bits of information together about the coronavirus in one video because it's becoming such a huge topic now that, if I just put out a bunch of separate videos about the coronavirus, it'll become extremely boring. But amongst all the bad news as the coronavirus spreads far and wide, and I'll tell you more about that in a second, there is some good news about the coronavirus, and I have to thank Jurgens for sending this information to me. And let me summarize. China has closed down its last coronavirus hospital. Not enough new cases to support them. Now remember, they opened up those 1,000-bed hospitals in about 10 days flat. They built them in about 10 days, quite extraordinary. But now they're actually closing down those coronavirus hospitals because the coronavirus apparently has done its job in China. It's kind of disappearing. Doctors in India have been successful in treating coronavirus. Combination of drugs used, lopinavir, ritonavir, oseltamivir, along with chlorpheniramine. You can see I'm not a physician. They're going to suggest same medicine globally. Okay, so they've found that. Now, Australia's found a very good cure as well. We'll come to that in a second. Researchers of the Erasmus Medical Center claim to have found an antibody against the coronavirus. A 103-year-old Chinese grandmother has made a full recovery from COVID-19 after being treated for 6 days in Wuhan, China. Apple is reopening all 42 China stores. Cleveland Clinic developed a COVID-19 test that gives results in hours, not days. Good news from South Korea, where the number of cases is now declining. Italy is hit hard, experts say, only because they have the oldest population in Europe. Scientists in Israel are likely to announce the development of a coronavirus vaccine. 3 Maryland coronavirus patients fully recovered, able to return to everyday life. A network of Canadian scientists are making excellent progress in COVID-19 research. A San Diego biotech company is developing a COVID-19 vaccine in collaboration with Duke University and National University of Singapore. Tulsa County's first positive COVID-19 case has recovered. This individual had 2 negative tests, which is indicator of recovery. Plasma from newly recovered patients from COVID-19 can treat others infected by COVID-19. So, it's not all bad news, guys, but let's go on to what's happening in South Africa now with COVID-19. Well, first of all, the worst thing you can have is someone who's tested positive for COVID-19 or the coronavirus wandering around the streets and acting as if there's nothing wrong. Why am I talking about this? Well, this is in Gauteng. The Gauteng Department of Health was forced to turn a court of law when a mother and daughter refused to be quarantined after testing positive for COVID-19. The pair, who could not be identified, tested positive after undergoing tests. The woman's husband refused to be tested. The woman, her husband and daughter were traced by police in the afternoon after the department obtained a court order in the early hours of Tuesday morning. Health Department spokesperson Kwara Kekana said they left the hospital without swabs being taken. The department then approached the court last night on an urgent basis in order to ensure that we didn't interfere with the constitutional rights of the patients without a court order. A court order was granted about 1 a.m. on Tuesday in favor of the department. Now, isn't it interesting that they talk here about the constitutional right of the patients and requiring a court order? Remember that discussion I had just yesterday with Advocate Viljoen about that little white settlement at Mamre, where the Democratic Alliance-led city of Cape Town basically invaded that small settlement at Mamre in the northern part of Cape Town precinct. And without a court order, they invaded people's homes, which is totally illegal. And I mention this because the interim leader of the Democratic Alliance said in a press release in response to my earlier video that even though they did not have a court order, they had every right in the world just to walk into people's homes with sniffer dogs, which, of course, Advocate Viljoen said is BS. They had no rights at all. All right, let's get back to this. The department pleaded with the public to cooperate with healthcare workers during this period of dealing with the coronavirus. Now, obviously, if you have the coronavirus, you isolate yourself and you stay out of the public way, because all you're going to do is spread that damn thing. Okay, now, what about the wineries in the Cape Winelands? Well, they're in shutdown too, believe it or not. Several top wine estates in the Cape Winelands have shut down their operations after a member of a Dutch wine tour, which visited 30 estates and venues during a 10-day trip, tested positive for COVID-19 at the weekend. Carl Lambour, general manager of Takara Wine and Olive Estate in Stellenbosch, said, "He's probably the patient zero of the winelands." The estate hosted a private dinner for the group on March the 9th, and Lambour sat next to the man for several hours. Lambour said, "That tour covered the length and breadth of our winemaking region. It's devastating." Lambour is now self-isolating at home, as are 2 members of his marketing team and the restaurant staff members who were on duty that night. The estate has closed its doors until the 24th of March. So you can see how this coronavirus has this kind of flow-on impact, and so many people now are just basically shutting down and quarantining themselves and keeping themselves out of harm's way. And that's something that's critical that elderly people do. Now, what about the ANC? President Cyril Ramaphosa has announced that all ANC conferences at regional and provincial level will be postponed for the next 3 months. Well, that's a get out of jail card free, isn't it? You know, they can sit on their big fat backsides and do nothing for 3 months now. Amazing. And they'll get paid by the taxpayer. This includes the ANC's much anticipated midterm policy review conference, the National General Council, or NGC, which will not sit as scheduled until further notice. This follows a meeting of the ANC National Working Committee on Monday at Irene, south of Pretoria, where the party briefed government employees of the pandemic. Ramaphosa announced that conferences and branch general meetings in preparation for those conferences will not be held until the decision is reviewed in 3 months' time. An ANC branch is made up of no less than 100 people. Any meetings would therefore be in contravention with the government's decision to ban gatherings of over 100 people. Now, it's interesting. When we talk about the ANC government, I wonder if they're going to follow Australia's lead. In Australia now, seriously, in Parliament, only certain members are allowed to sit at any time during Parliament, so that there's a safe distance between the parliamentarians. And then once they've done their shift, the next batch come in. It's quite extraordinary what's happening in Australia. And you've got the same problem in South Africa, because when the Parliament sits, they're going to be too close to each other, aren't they? So you're probably going to have to see or watch to see what the ANC do. I think they'll probably take the easy way out and just shut down Parliament until the coronavirus is gone. Take an extended holiday. Anyway, we'll see what happens there. Now, finally, drugs used to treat HIV and malaria could be used to tackle the coronavirus, according to scientists in Australia. A team of infectious disease experts at the University of Queensland, there, that's Brisbane, that's me, hey, say they have seen 2 existing medications manage to wipe out COVID-19 infections. Chloroquine, an anti-malarial drug, and HIV-suppressing combination, lopinavir and ritonavir, have both reportedly shown promising results in human tests and made the virus disappear in infected patients. Now, isn't it interesting? Because in India, they talked about exactly those two same drugs ending in ver as being the way to actually combat the coronavirus. The drugs have been tested as researchers and doctors around the world scramble to try and find a vaccine, curative treatment for the deadly virus. Around 170,000 people around the globe have now been infected with the coronavirus, and over 6,500 have died. After China managed to get a handle on its sudden outbreak, other countries were blindsided by huge epidemics. Almost 25,000 people have caught the virus in Italy, around 14,000 in Iran, 8,000 in Spain, and 5,000 apiece in Germany and France. Queensland researcher Professor David Patterson said he hopes to enroll people in larger-scale pharmaceutical trials by the end of this month. So there you go. It's not all bad news with the coronavirus, but what is going to be absolutely devastating in South Africa is the ANC government's complete lack of ability to control the spread of the virus. And as I said, once it gets into those townships, as the weather gets colder, it's going to be absolutely devastating, guys. Just be aware of that. It's going to be absolutely devastating. There's no question about that. Please remember to subscribe to be kept informed. Ring the bell for the updates. Please like this video. Please share this video. And above all, please stay safe.